Well, welcome everyone. Thank you again for being here today. And I'm hoping that I can address some of the questions that you had about nutrition and some of the concerns you had in today's presentation. So to get us started, I wanted to talk about why nutrition is important, some of the common concerns that my patients face, and then some of the strategies that you can employ to help your loved ones stay nourished. I will also share some resources some of my patients have found to be useful, and leave the end for some questions. So we know that our daily lifestyle and how we choose to nourish our bodies can have a big impact on our health and well-being. It can play a role in how cancer develops, how it progresses, and impact the strength a person has when fighting cancer. We know from evidence that with people who are well nourished tend to heal faster from surgery. They can experience fewer complications and infections, and often can be discharged from the hospital sooner. People who are well nourished while receiving chemotherapy or radiation can experience fewer side effects. They generally have a lower rate of toxicity and report better quality of life throughout their treatment. And this can mean that the patient is more likely to complete their treatment plan designed by their doctors and their team and gain the greatest possible control over their disease. And after treatment, good nutrition can also help with improved mood, maintaining muscle mass, and overall can contribute to survival as well. So often, I think with my patients, it helps for them to know a little bit about the role of the pancreas to better understand the side effects that impact their nutrition. So as you may already know, the pancreas is an organ in our abdominal area located behind the stomach. It depends, and depending on the type of pancreatic cancer someone has and the location, it can affect the exocrine, which means the ability of the pancreas to produce digestive juices, and or the endocrine or hormonal function that helps to manage our blood sugars. So the most common type of pancreatic cancer is called pancreatic adenocarcinoma, which is a type that can affect the secretion of these important digestive juices. So when there isn't enough pancreatic digestive juices available to digest the food that we eat, the body is unable to break down and digest the food properly. So as a result, people can often experience things like cramping, bloating, lots of gas, slightly loose or floaty bowel movements. And we'll talk about this a little bit more throughout the presentation. In addition to the impacts of the changes to the pancreatic function, cancer itself can also lead to weight loss. Weight loss is actually one of the most common reasons that a patient will be referred to see me. About 3/4 of people diagnosed with pancreatic cancer experience some unintentional weight loss, and about 25% of these people experience severe weight loss, which is a loss of 10% or more of the normal body weight within just a few months. As you can see, there are many causes of weight loss. First, cancer can increase our metabolism, which means the body is actually burning more energy in order to perform its normal everyday functions. The metabolism can be increased anywhere between 120 to 150% of what normally it is. And because of this reason, oftentimes I get patients that will tell me, I have good appetite, I'm eating the same amount I always do, and I don't understand why I keep losing weight. Also, due to the location of the pancreas in our abdomen and the location of the tumor, it can sometimes cause pain, discomfort, and nausea, and this can also lead to decreased appetite and weight loss as well. And if someone is experiencing fatigue, they can also be less motivated to eat, or when they do eat, they can eat smaller amounts, and over time that can also contribute to weight loss as well. So as we had discussed, patients with pancreatic cancer often face many challenges that are impacting their ability to stay nourished despite their efforts. And many patients notice that, their appetite is decreased, they're more fatigued, they're losing weight without trying to, or having more frequent and loose bowel movements. So we'll spend, some time talking about each of these in a bit more detail and some strategies patients have found helpful in dealing with their symptoms. So what can we do to manage these side effects? We talked about, decreased appetite is very common, and this can lead to unintentional weight loss. One of the main goals with nutrition, either during treatment or before or after, is to try and maintain your weight or a patient's weight. Eating smaller meals more frequently can often feel less daunting for patients when their appetite is low. Choosing higher protein and higher calorie foods allow people to have, more calories and protein in smaller quantities, so they're not having to eat as much to help maintain their weight. Softer foods and liquid foods can often be easier and less tiring to eat when the appetite is low. And often patients have lots of appointments, they're trying to attend to, and these appointments can take longer than expected and can lead to missed meals and snacks. So really trying to bring a snack when you can, something you can eat on the way or while you're waiting for your appointment, so that if the appointment ends up taking, an extra hour or two, people don't end up missing their meals. Appetite can fluctuate throughout the day for a lot of people, so really trying to take advantage of when the appetite is the best and eating the biggest meal when the appetite is the best, instead of kind of following a normal routine of maybe having your biggest meal at dinner can also be helpful. Also, drinking drinking liquids away from meal times can be helpful when appetite is low, because people don't want to fill. People can fill up easily on water or other low-calorie beverages. So it's good to try and drink most of the liquids, 30 minutes before or after a meal, so that you can save the room in your stomach for food. Sips of fluids are obviously okay, but just try not to drink, a big bowl of broth or water before a meal can be helpful. And, when people aren't feeling well and only, certain foods are appealing to them, trying to find their favorite foods or, something that they're able to tolerate and eat, and then trying to add in a little bit of extra protein and calories where you can be helpful to improve their intake as well. So diarrhea. There can be many causes of diarrhea, side effects of chemotherapy, not enough enzymes, or the digestive juices we mentioned earlier, infections such as C. difficile, certain medications, or even, too many after a patient has been constipated can also lead to diarrhea. And the solution for it often depends on, what the cause is. So trying to monitor your stool for any changes. Patients have said, they've never been more aware of their bowel movements. And looking for, changes in color, consistency, how often they're having bowel movements can make a difference. Keeping hydrated is also quite important, because if you're having diarrhea, you're probably losing, a lot more fluid than you normally would. So at least having 6 to 8 cups of fluids per day. And with fluids, it doesn't have to be water. Welcome to the new participants who just joined us. So it doesn't have to be water. You can have other fluids such as milk, soy milk, broth, soup, juice, smoothies, popsicles. These fluids with a bit of calories and protein can often be helpful. One, to keep us hydrated, but also it can contribute to the calories or protein as well. Smaller meals more frequently can be easier when someone isn't feeling well and they're having frequent bowel movements. But ultimately, if the diarrhea doesn't resolve after a couple of days, it's really important that you do talk to your healthcare team about any concerns and how to manage that. So pancreatic enzyme insufficiency, again, that's, when we talked about earlier about not enough of the digestive juices. So actually, more than 50% of people have this pancreatic enzyme insufficiency at the time of diagnosis. And this can be caused by either decreased production of these digestive juices or pancreatic enzymes. It can be blocked if there is a tumor or mass in the way, or if someone's had surgery and some of these enzyme producing cells have been removed. So symptoms with the pancreatic enzyme insufficiency can often include things like bloating, cramping, extra gas, changes to the stool consistency, or it can have a very strong odor. Sometimes people notice a layer of oil on top. Yeah, so if this is something you or your loved one notices, there is something that can be done and it can be improved. So really talking to your oncologist about whether pancreatic enzymes are a right fit for you, and if you are already taking enzymes, oftentimes it might just be that it's not the right dose, it might not be enough. So working with your team to find the right dose for you and making sure that they are taken with your meals and snacks. And, as we said, bloating is often a side effect of when, there's not enough pancreatic enzymes, but it can also be for other reasons. So really asking, yourself or the patient if this is usually associated with meals or snacks, if they notice, extra gas that they didn't before, if they're having loose or greasy stools. And talking to your healthcare team about whether this is related to either not enough pancreatic enzymes. And then also, it can help to limit foods or beverages that can increase bloating. So things like carbonated drinks, using a straw can give us extra gas as well. Things like beans and cabbage, so foods that normally cause extra gas. And then also, if someone's lactose intolerant, or you have discomfort with drinking milk or milk products, then that can also lead to extra bloating and gas for people. So if that's the case for you, then trying to avoid that. So fatigue can often be associated with either the disease itself or the treatment or chemotherapy that someone is going through. So really, listening to your body and trying not to overexert yourself. I've had a patient once tell me, he was planting trees all afternoon when he had a day of good energy, and then the next day he was completely wiped. So really, taking naps if you need to, and if you are able to, then trying to incorporate light exercise. So, even walking around the block or around the house can oftentimes improve the energy a little bit, and it can help to improve the appetite a little as well. Making sure that you're staying hydrated, because dehydration can often make us feel more tired as well. And if someone is sleeping through the day, then trying to wake up as you can in between to have small amounts of meals or liquids and snacks, so that they're not missing meals throughout the day and expediting the weight loss. So nausea is a common side effect we see with chemotherapy. It can also be associated with other things as well, but making sure that the patient is taking the anti-nausea medications as recommended by your doctor or the team, because oftentimes patients can find, I'm a little bit nauseous, I'll be okay, I don't need to take anything, and then the nausea can really kick in, and then it can be really hard to manage. So making sure, the anti-nausea is taken as prescribed. Keeping hydrated, taking sips of fluids throughout the day can help with the nausea as well. Bland foods, oftentimes people find more helpful when they're nauseous, or things that are at room temperature because the smell is not as strong. Or if the patient is having severe nausea, ideally they wouldn't be the one who's preparing the food, because the smell can often make the nausea worse and prevent them from wanting to eat it before they've even taken a bite. So, after talking about all the side effects and common concerns, what should a patient actually eat with pancreatic cancer? So everyone, is different, and what works for someone else may not work for you. It's important to note that, if you are losing weight, really focusing on those high protein, high calorie foods whenever it's possible. So, if you're going to, say, for example, have yogurt, try to get the Greek yogurt with a bit more protein, having one that's higher in fat. That will contribute to more calories. If you're making a meal, drizzling a little bit of extra olive oil, things like that to add in, a bit more extra protein and calories to help keep the weight stable. Of course, if your weight and appetite are good, and then it's important to just focus on a balanced diet and trying to include protein at each of your meals. So with protein, patients will often ask, well, what foods are high in protein and how much protein do I actually need? So, there are many high protein foods, as you can see in the list here, and they include vegetarian and non-vegetarian sources. So it can be, anything from lentils and beans, nuts and seed butters, soy products, poultry, meat, shellfish, seafood, eggs, really whatever the patient is craving and is part of their normal diets or routines. Sometimes people can find with nausea or just feeling unwell that they kind of don't feel like eating meat products. So that's when things like high fat yogurt and cheeses, or lentil soups or nuts, and things like peanut butter can come in really handy to add in that extra boost of protein. How much protein a person needs can really vary depending on what their weight is, whether if they've lost weight, they've had surgery, if they're, having chemotherapy, or, have other health conditions, and, what their activity level is. But in general, if someone is including protein with each of their meals, like a decent size, kind of usually we measure a serving of meat or chicken by the palm of our hands and the thickness of our pinkies. So if it's around that size that they're having with each meal, usually, people should be meeting their protein needs if they're having some at each meal. And you can also talk to a dietitian about more specific recommendations that are right for you. So, with decreased appetite, or if someone's not feeling well, often adding in high protein, high calorie snacks can be really helpful throughout the day. And, that can be a range of anything from, fruit and yogurt, things like waffles with some extra butter and syrup, hummus with, veggies, things like custard or cheese and crackers, or a slice of toast with some, peanut butter or another nut butter. Smoothies are a great way to add in extra protein and calories. People can even add in things like whipping cream, or, Greek yogurt or nuts and things like that to boost up the calories and protein without increasing the amount significantly. Or it can be as simple as adding in, a glass of milk or soy milk in between meals. That little bit of extra that you didn't, used to have can still contribute to maintaining the weight or making sure that you're having enough protein through the day. All these small amounts can add up throughout the day, and it all counts when you're trying to maintain your weight. So, we talk a lot about, high protein foods and high calorie foods. Well, what about fruits and vegetables? So my advice would be, include them if you can. If you can eat, if you are eating well and you have a good appetite, that's great. Then, try to include more fruits and vegetables. But when your appetite is low and someone is eating, very small amounts, really trying to prioritize that high protein, high calorie foods. So for example, if you're having a plate with, chicken, potatoes, and vegetables for dinner, then trying to focus on having the chicken and the mashed potatoes first, because that's where you're going to get the majority of your calories and protein, and then the vegetables or the salad after. That way, if someone gets full right away, then they would have at least gotten in some protein and extra calories, and that can help maintain a patient's weight if they're really eating very small amounts. Whoops, sorry about that. For those who can see the screen, okay. Yeah, so just, depending on how you're feeling, that can vary a bit. So if, someone has a good appetite, if they're eating well and their weight is stable, then we really try to aim for a balanced diet. So the picture here is from the New Canada's Food Guide, and you can see, half the plate is with fruits and vegetables, a quarter is with whole grains, and then the other quarter is with high protein foods, whether it's a vegetarian or non-vegetarian source. So really trying to aim for variety and balance if that's the case, that someone is feeling well and has good appetite, and trying to include fruits and vegetables at each of the meals and some protein source as well. That can really be great for maintaining your health overall for the long term. The high protein, high calorie diets and small amounts of vegetables and fruits are more so for, if you're not feeling well. So I wanted to talk a little bit about, a typical patient that I would see in clinic with pancreatic cancer. We have here Mrs. Allen. She's a 70-year-old woman, and she's married to a supportive partner and has 2 adult kids. She noticed recently that her appetite has been low and she's been eating less than her usual amount at meals. She's lost about 15 pounds in the past 6 months without trying to, and she's also noticed that when she has fries or any oily foods, that she gets more greasy stools. She's also having more bloating and gas about an hour after each meal. So I met with Mrs. Allen for initial nutrition consult, and we discussed her symptoms, what her eating patterns look like, and we helped make a plan for her to help better manage her symptoms and try to prevent her from losing more weight. We also worked with a team because we noticed that she had some signs of the inadequate pancreatic enzymes, and so we discussed with the team about starting her pancreatic enzymes with her meals and snacks. And she's noticed, over the next week, then she's had less greasy stools, and her bloating has improved quite a bit, and she's a bit more comfortable in between meals. So depending on how things are going, I may have several follow-up sessions with Mrs. Allen and help her improve her intake, and also help to optimize her pancreatic enzyme dose to help manage her symptoms a little bit better. So if your loved one has pancreatic cancer, it can be helpful, to note any of these symptoms. And if you do note these symptoms, it is good to discuss with your healthcare team, if, your partner or family should see a dietitian to come up with a plan that can help better manage their symptoms. So things like, if they're losing weight without trying to, and, if they have side effects from treatment, things like nausea, vomiting, diarrhea, poor appetite, or if they're noticing, the greasy stools, the signs of pancreatic enzymes not enough, it would be also good to see a dietitian for that reason as well. Also, if someone's having difficulty gaining weight after surgery and treatment, and they lost weight during treatment or right after surgery, then it would be helpful to see a dietitian to help manage that and help prevent further weight loss and help them hopefully try to gain a little bit of weight. Yeah, so, it's important to remember everyone's journey is different, and, what works for someone might not work for everyone. With pancreatic cancer, if, as a caregiver, if you are overwhelmed with preparing food, with, everything else that's going on, that's completely understandable. In Canada, there are many grocery and meal delivery services available. I'm not sure what's available in other countries, but many grocery store chains are starting to deliver foods to your home, so you can order them online and have them arrive at your home, so that can save time for other things that you have in your day to make your day less overwhelming. There's also some low-cost meal delivery options. In BC, we have Meals on Wheels or Better Meals that can deliver frozen meals to your home at a more reasonable cost. And if finances are a concern, try and look into your local food bank or other resources. Oftentimes, they can actually be not too difficult to access, and it can really take off some of the stress when food is is available, and you're not having to spend additional finances on that. Most cancer centers also have access to counselors for both patients and their families. At BC Cancer, we have counselors available for family members, I believe it's about 18 months after the patient's done treatment. So really, even after, if you're feeling overwhelmed, it can be helpful to just talk to somebody and have someone listen, because we know that it is a very difficult journey for people to go through, for anyone to go through. And just talking to your team about what services that are available to you in your area, and just seeing what's a right fit for you. Cancer.org also has a caregiver burnout resource guide. It's a pretty extensive guide through American Cancer Society, has a lot of great tips and resources. Canadian Cancer Society also has Cancer Connection, which has forums and groups that people can access to connect to other caregivers going through the same situations. And some take-home messages. So really, to summarize the presentation today, our goal is really to aim to prevent any unintentional weight loss. Again, if a patient has low appetite, really focusing on those high protein, high calorie foods. Talking to the medical team about any of those symptoms, that are impacting their nutrition, and finding ways to improve the symptoms so that they can eat better. And everyone has a different journey and a different experience, so see your dietitian for a personalized plan with what to eat and your nutrition. And if the patient has a good appetite and their weight is stable, then that's obviously the best case scenario. Then just aiming for a balanced diet, because that's the best thing you can do for your body and keeping it nourished. So some additional resources. If you go to the BC Cancer website, I've linked it here. You can access a lot of the resources to do with nutrition. So some high protein, high calorie food guides and lots of different meal suggestions. Other resources to manage symptoms during treatment for nausea and tips for that, and more specific things. We have a couple of different languages as well that's available. In BC, we have HealthLink BC, which is a free service that a patient or a family member can call to talk to an oncology dietitian or a nurse or an exercise specialist, and to answer any questions that they might have about nutrition or other things. Ontario also has through Eat Right Ontario and where you can access a dietitian for free, I believe online or through the phone. Canadian Cancer Society, again, has lots of great resources and forums that can connect you with patients with other patients or family members with other family members. Pancreatic Cancer Action Network is also a really great resource that links free webinars, resources for patients. There's a nutrition and diet and nutrition and pancreas cancer booklet that's really helpful. American Institute of Cancer Research and Memorial Sloan Kettering are two really good resources for evidence-based information. Memorial Sloan Kettering also has their About Herbs app. It's free, and essentially it has a lot of different foods and herbs on there or supplements. So, if you see something online, you're not sure if it's evidence-based, if it's going to be helpful, then it can be helpful to look that up. Things like turmeric and whatnot are all on there. So, if you want more information, that's a really great resource. And yeah, so thank you everyone again for being here today and for being part of the presentation. And I'm happy to answer any questions that you have.
Thank you, Nancy. It's Cindy again. Excuse me. I did receive a group chat from one of the participants, so I'm going to ask that some questions for this person. First question is, what about a burning in the back of the throat, like a chemical taste that makes food taste bad?
Okay, yeah, so depending on the treatment or certain medications, that can be a side effect with taste changes, I believe, is what the person is experiencing. The burning sensation, it would be good to see the doctor about and seeing what the cause is. But in terms of taste changes, a lot of times people can experience this, and depending on what the taste changes is, it's good to try a variety of different foods. Sometimes things like buffets or salad food bars and things like that can be helpful, where they can try a little bit of each item and seeing what works for them and what doesn't work. Sometimes their favorite foods may not taste good to them, so really trying to find other options that does work. Condiments or spices or herbs can be really helpful. I had a patient, who had his taste was very decreased. So he found blueberry jam was one of the things that he could taste. So he would put that on chicken, put that on a piece of toast and other things. So it's very individualized in what works for the patient themselves, but on the BC Cancer website, there is a specific resource on taste changes and more specific advice for that as well.
Excellent, thank you. And the other question is, and I don't know if this is really your area, but it's, how do you deal with someone who reacts negatively and strongly to feeling pressured to eat? Even trying to softly suggest having a protein drink or snack seems to set up an oppositional attitude that results in no eating.
Yeah. That's a great question, and oftentimes actually because if patients are having ongoing weight loss and it becomes a huge concern, it can be really an area of tension for a lot of families. The patient feels pressured to eat and the family members are worried that they're not eating. So really trying to let the patient choose what they are able to eat, and finding eating things that they're okay with and that are less difficult. So things like, more beverages and fluids, like kind of like the protein shakes that were mentioned, can be easier for patients. So if it's easier for them, they sometimes are less or are more willing to give it a try. But again, depending on kind of your personal experience, and it can be helpful to talk to a dietitian, and also even maybe a counselor, and seeing what the underlying barriers are, and kind of trying to explore those and seeing how we can overcome it. Sometimes patients are really overwhelmed, and they can't control their symptoms, they can't control the treatment, and so food becomes one of those things that they feel like they have control over. So they can sometimes be more picky about what they will and will not eat. So really, our job is to work with the patient to find, okay, what works for you, because at the end of the day, I can make all these suggestions, or the other team members can make all these suggestions, but if it doesn't work for the patient, and if they're not going to eat it, it really, is not going to make an impact.
Thank you. Another question is, someone is beginning to experience hair loss. Are there foods or supplements that can help with this?
So hair loss is one of those things, unfortunately, can be a side effect of a lot of chemo. And generally, we don't actually recommend any specific diets for people with hair loss. If they're eating a balanced diet and they're getting enough protein, then that's kind of what we aim for. And the hair will generally grow back after the treatment. So we try to remind patients it is temporary. Maybe finding a fun wig that they like, or certain cancer centers, there's volunteer areas where they can pick out a nice hat or toque or something to keep their head warm in the meantime.
Thank you. Now, one question here, and I guess you can answer, excuse me, this, we talked about it a bit earlier. It says, wondering if the online dietitian for Ontario, I think she thought you were from Ontario, but from BC actually, is available for people in other provinces. And I think we spoke a bit about that, so if you could.
Yeah, so I know that there's a dietitian that they can patients can access for free through Ontario, through BC as well. Unfortunately, HealthLink BC is only available in BC, but other provinces also have dietitians as well. It just takes a little bit of digging to find what the resources are in your area, and sometimes if you ask your doctor or your nurse or something, oftentimes they might know, because they've had other patients with the same questions. So yeah, so using that as a resource to find what are the services and dietitians available in your area. There are also private dietitians who are available throughout Canada and other countries as well. But yeah, if you are in Canada, there are access to dietitians that are usually part of the center, or online for free, or through the phone for free.